Most welcome. Today we're going to discuss about roles of thyroid hormones. W7sense theater at gmail.com. This is part 2 of thyroid hormones. We had part 1, the recent video. So you enjoy? Okay. Yeah, W7sense theater. You like, you subscribe, you share. You subscribe for better and more videos. You share to your fellows, to other students to also enjoy, and other people to learn the science. Okay. Effects on growth and tissue development. That is the first role of thyroid hormones. These hormones, uh, they have a role in body growth and skeletal maturation. They have a role in bone development, development of teeth, normal cycle of growth and maturation, and development of subcutaneous tissues. They have a role in tissue differentiation and maturation. They have a role in development of nervous system. For this reason, mental retardation has been a striking feature in children with congenital hypothyroidism. When the hormones are low, those children usually present with mental retardation because these hormones are important in development of the nervous system, the thyroid hormones. Effect on metabolic rate in general. The thyroid hormone in general stimulates the metabolic activities and increases the basal rate of oxygen consumption and heat production in most tissues of the body except the brain, retina, gonads, lungs, and spleen. Yeah, these hormones, they stimulate the metabolic activities and increase basal rate of oxygen consumption and heat production in most of the body tissues. Okay. Effect on carbohydrate metabolism. T3 and T4 lead on to an overall increase in enzymes. That is what they do. So therefore, they cause increased glucose absorption from the GIT and acceleration in almost all aspects of glucose metabolism. They accelerate almost all aspects of glucose metabolism, i.e., you can have rapid uptake of glucose by the cells, and therefore you have enhanced glycolysis, enhanced gluconeogenesis, and increased insulin secretion and its effects on the carbohydrate metabolism. Okay, how do thyroid hormones affect fat metabolism? Thyroid hormones, they cause the following effects. Have mobilization of fat from adipose tissue. This increases levels of fatty acids and enhances oxidation of free fatty acids by cells. It decreases in the quantity of cholesterol, phospholipids, and tags in plasma. Plasma cholesterol level is lowered due to increased excretion in bile. You get? The level of cholesterol in plasma is lowered due to increased excretion of cholesterol in bile due to the effect of thyroid hormones. That's how they decrease the quantity of cholesterol. Therefore, hypothyroidism is associated with elevated plasma cholesterol levels, which can be reversed by thyroid hormone administration. In such patients which have low levels of thyroid hormones, they will be having elevated plasma cholesterol, basically LDLs. So this can be reversed by giving the hormone thyroid hormone. Yeah. Okay, effect on protein metabolism. In physiological amounts, the thyroid hormones function as anabolic hormones, that they can cause an increase in RNA and protein synthesis, leading to positive nitrogen balance. You get, when we synthesize more protein, means we are causing a positive nitrogen balance. Okay. In high concentrations, thyroid hormones have catabolic effect. They function as anabolic hormones that cause an increase in RNA and protein synthesis, thus a positive nitrogen balance. However, in high concentrations, the thyroid hormones have catabolic effect. Mark this. In physiological amounts, they are anabolic, but in high concentrations, they have catabolic effect, leading to negative nitrogen balance. Therefore, muscle weakness and creatinuria are characteristic features of hyperthyroidic patients. Yes, you have a lot of creatinine in urine and the muscles are weak. You have creatinine in the urine and the muscles are weak due to a negative nitrogen balance caused by high concentration of thyroid hormones. Effect on vitamin metabolism. The thyroid hormones increase quantity of enzymes. Therefore, being that vitamins are essential parts of the enzymes as coenzymes, therefore, an increased need for vitamins leads to relative vitamin deficiency in hyperthyroidic patients. Patients with too much thyroid hormones, they will have more enzyme synthesis. Therefore, more vitamins will be required to synthesize these enzymes, or as they form components of those enzymes. NB, T4 is essential for conversion of carotene to vitamin A. In hypothyroidism, carotenemia gives a yellow color to the skin. Yes. So when you have less T4, carotene accumulates in blood because it had to be converted to vitamin A, so it accumulates in blood, but it gives a yellow color. How do you distinguish it from bilirubinemia? And be clinically differentiated from jaundice by the fact that sclera of the eyeballs are not affected in the former condition. In carotenemia, the sclera of eyeballs do not turn yellow. Yeah. Effect on water and electrolyte balance. The thyroid hormones play a role in regulation of water and electrolyte balance. Impairment of thyroid function is associated with retention of water and electrolytes, which can be reversed by giving the thyroid hormones. You get a point? Yeah, when you have impaired thyroid gland, water will be retained and electrolytes will be retained. Therefore, this you can reverse it by administering the hormone. Effects on respiratory system. Thyroid hormones stimulate oxygen utilization by the following effects. Yes, they promote oxygen utilization by the following effects. 1. They increase resting respiratory rate, minute ventilation, and ventilatory responses to hypercapnia and hypoxia. These actions maintain a normal partial pressure of oxygen when oxygen utilization is increased, and a normal partial pressure of carbon dioxide when carbon dioxide production is increased. You get a point. These actions of like increasing respiratory rate arrest minute ventilation and ventilatory responses to hypercapnia, high levels of carbon dioxide, and hypoxia. These actions maintain a normal partial pressure of oxygen when oxygen utilization is increased, and a normal partial pressure of carbon dioxide when carbon dioxide production is increased. 2. By this effect of increase in oxygen carrying capacity of blood by slightly increasing the red blood cell mass. Yes, that's how they increase oxygen utilization. Effects on gastrointestinal system. How do thyroid hormones affect the gastrointestinal tract? They increase appetite and therefore increase food intake. Yeah. They increase the rate of excretion of digestive juices. That is the thyroid hormones. They increase motility of GIT. Excess of motility of GIT. Excess of thyroid hormone often causes diarrhea because the gastrointestinal tract is rapidly more. There's a great motility. It means you have increased heat there, in addition to other factors which cause diarrhea. Yes, you lose a lot of water. Less absorption of water will occur due to increased motility, and the effect is having diarrhea. Yes, effects on reproductive system. How do thyroid hormones affect reproductive system? In both women and men, thyronines play permissive role in regulation of reproductive functions. Permissiveness, yeah. In males, lack of thyroid hormone causes complete loss of libido, love for sex, and excess of hormones causes impotence. So if you just lack the hormones, you have no you have no love for sex. And if you have excess of hormones, you'll become impotent. You'll fail to erect, yeah, if you're a man. In females, lack of thyroid hormones has varying effects. For example, you can have menorrhagia and polymenorrhagia. Then you can get irregular periods, or even amenorrhea occurs in some women. Okay. Effects on the kidney. How does the thyroid hormone affect kidney? The, the rate of flow of plasma to the kidney, glomerular filtration rate, and tubular transport maximum for a number of substances are also increased by the thyroid hormone. Effects on the nervous system. A. They affect the development of the nervous system, the thyroid hormones. They play an essential role in development of the nervous system. B. They have an effect on functioning of nervous system in adults. Development, development of nervous system basically occurs in the fetus or during the uterine life. So now if we have adults, the function of the nervous system also depends on the thyroid hormones. That is, if one enhances wakefulness, alertness, responsiveness to various stimuli, auditory sense, awareness of hunger, memory, and learning capacity. All of these are stimulated by the tetraiodothyronine. Okay. Then we have thyroid hormone increases the speed and amplitude of peripheral nerve reflexes. When you have thyroid hormone, the rate of reflex activity is faster. The speed and amplitude of peripheral nerve reflexes increases. Effect on other endocrine glands. Pituitary production of growth hormone is increased, whereas that of prolactin is decreased in presence of thyroid hormones. Yes, growth hormone less will be produced. It will be increased, I mean, while prolactin will be decreased. Adrenocortical secretion of cortisol, as well as metabolic clearance of this hormone, is stimulated, but plasma-free cortisol levels remain normal. Yes, this is because the thyroid hormones are increasing secretion of cortisol, the hormone of stress, but as well they are also increasing the rate of clearance of the hormone. So the levels stay normal within the plasma. Estrogens and androgen ratio in males is increased in presence of thyroid hormones. Okay. It accounts for occurrence of breast engorgement in males in hyperthyroidism. I think you get this point. Some males have engorged breasts in case of hyperthyroidism. Parathormone and 1,25-hydroxy to vitamin D is parathyroid hormone, and this hormone that activated vitamin D are decreased in presence of thyroid hormones. Effects on the cardiovascular system. These hormones increase cardiac output, ensuring sufficient oxygen delivery to the tissues. Thyroid hormones will cause tachycardia. The force of cardiac contraction will be increased. The cardiac inotropic effects are via adrenergic stimulation. Myocardial calcium uptake and adenyl cyclase activity are increased, and enhanced contractile force. Yeah, the contractile force will be increased. Yeah. Third, cardiac output is increased as a result of increased blood volume, increased heart rate, and increased force of contraction. Lastly, the systolic blood pressure increases due to reason strength and rate of heartbeat, whereas the diastolic blood pressure reduces due to peripheral vasodilatation. This results into an increased pulse pressure, but the mean arterial pressure is usually unchanged. Yeah, thanks for watching the video. Thanks for watching this video. Take note of this. SBP increases while DBP reduces. Cardiac output increases, force of contraction increases. Tachycardia also occurs as we want to increase or ensure sufficient oxygen delivery to the tissues which are undergoing increased metabolism. Okay. You like us, share to other students to also enjoy, subscribe for more and better videos. Okay, thank you.